So Aikido re-entry into post-pandemic year one. Panel discussion will consider what a return to Aikido training after the pandemic here in Canada could be like. With experience in infectious disease control and firsthand knowledge, which will be a big part of our discussion today, we can look at how other countries are navigating, as well as how Canada may navigate a return to Aikido training. Our panelists will provide a view of what they may expect and the changing landscape of the post-pandemic world. And I think what's important to note is that a lot of this is what we anticipate, what we think is going to happen, because of course things are changing quite quickly, and this is just the best guess based on experiences and some expertise. So welcome you all to our session today, and just a little bit more about some of the expertise that we have and why we have collected this specific panel. Myrna is very active in the BCAF with the Restart Guidelines, worked on a team to edit and complete information from Public Health and Via Sport, as well as WorkSafe BC, Parks and Recreation, and Judo BC into a format that was applicable to the BC dojos. So really tailoring some information to help the dojos in BC based on their local conditions there on how to sort of acclimate to this new pandemic situation. She also has other BCAF activities. She's hosted several events with the aim of dispersing information, where there were panelists, Dr. Bob Wolber, and as well Scott McMillan. And she disseminated some of the information from those individuals. They're very expert in their fields. She also maintaining inter-dojo community connections. And this one's interesting. I'd like to get a little bit more into that later on in the discussion, Myrna, because I think that is going to be an important piece, but just really connecting the Aikido community during the pandemic. Finally, Aikido Blaze, Myrna has been involved in that as well. It was a chance to bring together people who otherwise were not participating in Zoom classes, or for beginner students who are finding the Zoom classes difficult to conceptualize. This was an opportunity to allow people to share stories and ideas across Canada and the US. And I suspect would encourage different teaching techniques and introduce concepts that might be easily adopted into solo training. And I think that will be another part of our discussion for today, is the solo training part. A little bit more about Michelle, an experienced nurse, and Michelle started to work as an infection control and prevention officer in 2003 and had to work in outbreaks detection and management. She had to develop an important pandemic program where she worked in 2006 after the H5N1 avian pandemic came to be about. And I don't know if you are all aware, but there has been some mention of another variant or version of the avian flu recently has come out. And so this is something that, we also have to keep on mind, is that there are other viruses that may be taking center stage. So we'll be aware of that through our discussion. Michelle has also dealt with the H1N1 in 2009 and last year. As a recent retired nurse, she was called back at her former job to help prepare early detection and control of COVID-19. She became rapidly conscious of micro droplets or aerosols, transmissions, and risks that it poses to frontline workers and the community in general. Michelle is up to date in her knowledge of COVID-19, and she is one of our frontline workers involved in administering the COVID-19 vaccination. So there's a lot of experience. Jean-Francois has firsthand experience in working and being immersed in the United States, so we can compare and contrast some things in terms of different geographies and how they are re-entering. And so without further ado, let's get started. The intent today is just really to have an organic conversation. It was interesting yesterday during the Osawa Sensei class, the question was asked to him what he thought about the future of Aikido, and specifically as it impacts, the pandemic impacts Aikido. And it was very refreshing and sort of reassuring to know that we don't all, no one person is responsible for and is going to provide you the single answer. I think this is going to be the Aikido community coming together and working through this together to figure out, how do we safely re-enter into practice? So for me, just to start, I can tell you that since the pandemic has started, it has really impacted my Aikido life and my Aikido training. And of course, it has reduced my ability to continue training and keeping up with, my health and, my cardio, which is, I'm really finding my cardio has been impacted. I used to be able to walk up flights of stairs, no problem. And now I find myself panting quite a bit after, getting up the first flight of stairs. So definitely something that is impacting is the lack of training in the dojo. We have at the Japanese Canadian Cultural Center, JCCC Aikikai, who is headed up by Adrian Iliescu, who has joined us here today. We have adapted by having Zoom classes. They are largely they're all led by Adrian Sensei. So I'd like to thank him for that personally now in terms of keeping that going. And we also attempt to have outdoor classes, which we did have a few at the summer of last year. So that's how it's impacted our dojo. It's impacted me personally. And I'll open it up to the panel to have you guys share a little bit of your experiences. What has it been like for you during this pandemic time so far? And I'll start with you, Myrna.
Me first. I would say that the pandemic has had a big effect on us here in BC. My own dojo hasn't been active at all. Basically, my students said, we'll wait until we can practice in person again. And they haven't been really interested in transitioning to online or even outdoor classes at all. So initially, I was just kind of, I refocused on work and family. But I really find that when I'm not doing Aikido, that it does have, I'm the better version of myself when I'm at least doing a little bit of Aikido. So about the, around the beginning of the new year, new resolutions and all that, I thought, okay, I got to start doing something. So I began training online with both Vancouver and Victoria dojos. And kind of like through my position on the BCAF, we had been doing a lot of work, a lot of collaborating over Zoom. And I started to see kind of the potential for building community and keeping in touch with the larger community beyond my own dojo. And so then my emphasis sort of has shifted to that. And I actually don't really see it as being a restart in terms that there are a lot of people who have just continued, they have continued to train on their own. They have continued to teach classes, they've adapted. And so I see it more as a transformation than a restart. And I think, it's been a really difficult time for everyone. And I hope that we kind of find some things to learn and grow from this period that we can carry with us forward.
Absolutely. So I'm hearing reaching out to the community, sharing ideas during this pandemic time and kind of sharing in experiences. Just some comments coming in terms of how they're feeling and being and adapting. Some folks are also acknowledging that, yes, they're feeling a little less athletic during this time, and that they try to take opportunities to adjust and to get those quick cardio bursts in. Some folks mentioned that they do some jumping jacks before some of these virtual sessions. So getting those quick cardio bursts in, building up your cardio system and keeping some good circulation is always a good opportunity to maintain good health. Michelle, how has your experiences been so far in the pandemic?
Okay, let's put it this way. When 2020 started, I reserved a trip in April in Mexico. Okay, so that hasn't been done, of course. I started as a retired person. I started also a new job in a surgery clinic. So that was at the end of February, and 2 weeks afterward, I had to stop because it was the biggest shutdown. Okay. So the last class I gave was the March 12th, and I told it was our last class of Aikido. I said to my students, it's our last class. They say it's going to be 4 weeks, but I'm really pessimist. It's going to last months, and it's lasting more than months now. I started back at my former job, like an infection control officer, and it was purely held into the senior houses. Okay, we lost about 40% of our patients. About like 60% of the personnel was sick, including me, because we were not protected well. And as I was doing some testing over the patient, I realized that micro droplets were really a really nice way of transmitting. Okay, nice is being not a good word. Okay, so yeah, it affected me because I got the COVID at the beginning of April. It was a long process, difficult, and I went back on my feet. I thought I would be completely healed with this, and it's not true because I got the long COVID. At the time, we didn't know what it was. Now we know that. So I still have shortness of breath a bit, and I still have some fatigue here and there. Okay, I'm not complaining because this is minor comparatively to some other people, but I thought during the summer I would be perfectly correct, but it still lasted. So this is the thing that happened. When I continued to give advices to my former colleagues. I still work in the surgery clinic where I talk about that because they were lacking nurses. We lost a lot of nurses, administrative people when we came back from the shutdown. It was mid-May. So I had to work more than 2 days a week. I was working 4 or 5 days a week and including some calls from my house, things like this. So that was really a really heavy period. Aikido, no Aikido, because I really was not trusting the information we got. You have to understand that I started as an infection control officer in 2003. What was going on in 2003? The SARS. So at the beginning of the SARS, everyone would be wearing N95 mask until we knew about the way of transmitting and we would have more knowledge. In 2005, H5N1, that didn't come in here, but we were ready to catch it if we got it, okay? So the year after, like Collin said, I had to make a full document talking about how we would deal into the senior house if we had the COVID and not the COVID, but the H5N1 or any pandemics in order to be able to function a full week without any help from the outside. H9N1 was terrible. We got it here. I had to work with the public health and I had to work with the establishment I had. So that were the 1, 2, 3, and now the COVID-19, the 4th pandemic I'm going through. So believe me, I have quite a bit of knowledge about that, okay? So that's how we function. I have to say that for the Aikido, we didn't start. One of the things is because I was too tired during the whole summer. And at the building, we were practicing, we were not sure about how it would be healthy to practice. So we didn't start. I still get contacts with my students. And while that wonderful seminar we're doing is going to give, I think, a lot of positive thinking for everyone. So that's it.
Thank you for sharing that. That's a lot of great, experience that you shared with us, particularly the fact that you yourself was affected personally by COVID-19. You were infected by the virus, and you have been able to recover from it, and not only just recover from it, but continue your Aikido practice and maintain, some vigor. So in terms of post-pandemic and, after there's light at the end of the tunnel. There's hope, right? And you are the embodiment of that. So thank you for sharing that. And, it's interesting as well to be able to look into another region and see kind of what's happening there. We talk about our experiences here in Canada, but Jean-Francois, you moved over to the United States and started practicing there for professional reasons in 2014. So maybe you can give us a little bit of what your experiences have been, both contrasting here in Canada and the United States. We'll get into more details of specific things in your dojo later on, but for now, maybe you can just give us a very high level general perspective on, how were you impacted? What was your life like in the United States during the beginning of the pandemic?
And the context was slightly different because the big difference between at least province of Quebec compared to the US and Virginia where I was, the government was much more, let's say, rigorous to apply, because in Quebec you could have a fine if you don't follow the recommendation of the government. In the US it was not the case. There was a CDC that was making recommendation. But if people was not following the recommendation, then there was no fine or any consequence about that. But as a dojo where I practice in the US, what we did, we come together and we close out like everybody else last March 2020. And we were able to reopen in July without contact. And what we did, we said, okay, we keep social distancing, wearing the mask, protocol for cleaning the dojo itself, but also asking the student, okay, when you enter, you have sanitizer, you need to use it and stuff like that. And we were able to do at least some practice at the dojo. We were limiting also the number of people that, based on the space, to keep the social distancing. Then since July 2020, in the US, we were able to reopen with limitation for sure. And after that, we were just following the CDC, and now we are going back to almost normal practice. Probably by 2 weeks from now, we have a meeting together talking about that, because here, when you have been vaccinated, you have your 2 vaccines, and the strategy may be slightly different in Canada, but here when you get your vaccine, 3 weeks later, you get your second one. You have your 2 shots. And they say you don't have to wear a mask. You're free to meet with people. Then the restrictions are removed at that point. And but the experience we had, we need to stay really connected, I think, with the students, because we all have a different tolerance, if I could use that word, about this. And there was some student that even last year, it didn't care about the COVID. That's what it is. And some other was very concerned about that. And what we did, we opened, I think we opened 4 classes at the beginning, and we were saying, okay, this class, at the beginning, nobody was really having contact, but some people didn't want to wear masks. It was against their way of seeing at these things. Then we say, people that doesn't want to wear masks, you could go to that class. And other people with the most restriction need to go to these classes. And to do that there, because there was no consequence for people who don't want to follow the CDC recommendation. And that's why it's really different, I would say, between the US and Canada, because the consequences are different if you don't follow what your provincial government is put in place as a safety measure.
And that's important. And I think that's going to be a theme throughout our conversation today, because you know, we need to appreciate the fact that while there's going to be a lot of recommendations, suggestions, there are guidelines that we are going to need to become aware of, and that we're going to need to follow provincially, perhaps in your city, your town, and of course federally. So understanding what the expectations are, and then sort of meeting those to make sure that you know, we're staying within guidelines and avoiding you know, anything like fines is going to be an important step for all of us as we re-enter. So thank you all for sharing what your experiences were at the beginning, and sort of giving us some insight there. Just some comments that I am noticing that are coming out is to do with mental health, and how Aikido has in fact helped with that perspective as well. And that Aikido has sort of kept people stimulated, engaged, perhaps providing a sense of normalcy, getting into some solo practice at home, and the Zoom practices, back to Myrna's point, and with the Aikido Blaze, and why that's so important. So let's talk a little bit about that real quick, because we are talking about, you know, the impact of Aikido on us, and how we will get back in, or the pandemic on us, and how we will get back into Aikido post-pandemic. So of course, Jean-François, you just touched on it to say that some people are a little bit more, you know, sensitive. There may be some, you know, sensitivities in terms of fears, apprehensions about, you know, how to do this. Some people may want only distance practice. Some people may want to have the contact practice. So what are some of the things that we can be doing to be able to accommodate? Jean-François, you did mention that we could have different classes. So I'll open this question up first to Michelle, and sort of accommodating the different levels of comfort in the dojo going forward post-pandemic, and keeping in mind the way that the virus is transferred, right? So we're talking about the aerosol. So how do we manage those aspects? Appreciating the different comfort levels, but yet still being very diligent about not transmitting the virus. You're on mute.
Okay, first of all, we have to do an update of what is about COVID-19. So I don't know if you're going to see what I'm putting here. Do you see it well?
Yes,
yeah,
can
see it well. Okay. So first of all, the profile, that's the update that I had when I started vaccinating, okay? We all know that, it's difficult to do this, that you can have a contact minus 14 day. Day 0 is where you get to have the symptoms, if you do have symptoms, okay? So minus 14 could be where you get the contact here. Between 0 and minus 14, okay? That's where you get the contact. That's why health authorities go back 14 days when they see, when it's starting to go up, when the cases are getting increased, they can go to minus 2 weeks before, where everyone, let's say that there has been a big meeting or anything. So that's it here. So the virus is growing. Minus 2 days, you can contaminate, but you don't have symptoms yet, okay? So this is a danger. There is a danger here. From day 0, you can contaminate up to the 10 day. Before, in 2020, we were thinking about 14 days. That's why when you had the COVID, you had to be off work or off in your house for 14 days. Now it's about, they go up to 10 days, okay? But one thing that we have to emphasize is 20% of the cases don't have any symptoms. I didn't think it was that high, but 20% of the people who get COVID, who are COVID positive, don't have any symptoms. Okay, that's what we discovered. That's what I had. This is the Quebec, Canada knowledge, okay, what I have. So this is a lot. That's why doing epidemiology, tracing the cases is so important. And when you're about to say, you hear about that, I had one of the students got a COVID, you all have to be tested. No, I don't have any symptoms. It's very important to go and test yourself. Okay, second thing. Now, I don't know if you're going to see it well. Okay, I'm going to go on the other side because I have to see what I'm telling you. Okay. 2020, 2021. At first, we thought it was droplets, contact, the transmission would be droplets. So we would have to wear a mask, we would have to a face cover, we would have to protect the eyes, we would wear some gowns. I'm talking about people who were into the hospitals. By contact, do you recall, did you have this thing that you had to wash up everything? You do your grocery and you would have to wash up everything. Did you have that into a BC, Myrna?
Sorry, did we have what?
Washing, we were like when we do the grocery, you would have to wash everything. Fruits, veggies, cans, meat. We would have to do this. It was a real panic. Everything you would bring back home, you would have to wash it.
Yes.
So we had that at the time. So washing washing the hands is very important. It still is. Washing the surfaces is very important. We talked about the distance, 2 meters here, but some countries it's 1 meter. The WHO organization, World Health Organization, is talking about 1 meter. Okay. 2021. Now we know that not only there is the droplet transmission par gouttelette, excuse me, I forgot to speak in French a bit. Now it's not only a face cover. We ask people to try as much as possible to wear surgical mask or procedures mask. Okay. Eye protection is maybe less important than it was, but it's important. The thing that is the most important thing is aerosol, micro droplets. We know that the transmission is really done into crowded places, poor ventilation. This is the most important thing that we know of now, and extended contacts. Donc, la transmission par aérosol on croit maintenant qu'elle est de plus en plus importante. Des endroits bondés, pensez à des bars, ventilation déficiente, des contacts prolongés, donc on reste longtemps. For about contacts, now we don't have to wash up the food and everything because the time, the percentage of contamination is very low into this. Les surfaces, on doit continuer à laver les surfaces. Though we know that the virus level into surfaces has to be strong enough and it has to be very important in order to get contaminated, okay? So, and we don't know necessarily what is about how long, that's changed a lot. How long a virus can stand plastic, metal, and everything, it changes, okay? But it needs an important charge virale, important viral charge to contaminate someone by contact, okay? In the hospital, it's something else because it could be in contact, direct to direct, hand by hand, or of course, in the normal population, it's the same when you got quite a bit of direct contact, or I give my glass to someone else and she's drinking into it or picking up a cigarette or whatever. Okay, danger, lower distance, even if we can have some danger into a room, okay? So that's very important. But the most important thing that is a very positive thing, vaccination. Okay, I think it's the way we're gonna save ourselves. We won't drop everything, that's for sure. But I think that vaccination, the vaccine, according different of the name of the vaccines or the way it is, it has been built like ARN messager is much more efficient than Johnson & Johnson and so on, AstraZeneca, but it still goes between 65% and 95%, okay? And this is good, even 65% is good. When I used to give the flu shots to the employees and some people where I used to work before, sometimes it would be like 20, 30, 50% efficient for the flu vaccination, but you would be getting less sick. So for the vaccination, we're up to now, and in Canada, it goes very well. In the Quebec province, it goes really, really well because the government said that 75% of the population would have at least the first dose on the 24th of June. And as of now, we are to that level. So it's going very well. So, and since, like comparatively to 2020, May 24, we were about like 500 cases. 2021, 500 cases. And from that time, because of the vaccination, it has dropped dramatically. So that's what I have to say about the update of the COVID-19. Do someone have some question about that?
Yeah, the science behind it. Thank you so much. That's really important. So, you know, the period of time when you are first infected to when the symptoms come, how the transmission occurs. And you've actually, can everyone hear me okay?
Yes.
Yeah, okay. Seems to be a bit of a delay on my side. So the important thing that you did touch on that did come up in the chat, and so thank you for touching on that, Michelle, is the ventilation going forward in the closed spaces. So in the dojos, ventilation is going to be very much an important factor. And so that will be something that is going to need to be watched very closely. Are there going to be more heightened and increased guidelines around that? Let's wait to see if that will change. Also around the vaccination and your view and perspective that the vaccinations are going to be important. Some folks in the chat are sort of suggesting that you know, they feel that the vaccination is really protecting themselves, and really it's those who are non-vaccinated who are largely at risk, and so this is a factor that needs to be considered as well. So one of the things as well that was just touched on, and some folks are asking, is in terms of a gradual return to the physical practice. So we've talked a little bit about the science and what the risks are. And so we understand a little bit of the landscape about how we would get back into practice, like literally making your way to the dojo. Are there things that we need to do at home in advance of the dojo to prepare ourselves for practice? Once we are at the dojo, what are some of the protocols that might be in place? And sort of what's the overall theme in terms of getting back to practice? We've already acknowledged that some of us have not been at our peak performance. And so also getting back into full contact hardcore practice, or do we take a gradual approach and sort of blend that in with some virtual training? So sort of what are your thoughts in terms of a blended training, Myrna? How does that is that probable? Is that something that will sort of help us get back into training in a year after post-pandemic COVID? Do we jump right back in and just have some, you know, protocols, hand sanitizer, et cetera? Or do we blend it with some Zoom practice and then have some classes that are just for folks who are extremely sensitive versus those who are more flexible, and then eventually get back to a hardcore practice? What are your thoughts on that?
I think that it's important to recognize the fact that there's a great diversity in risk tolerance. You have some people who are very risk adverse, and some people, you know, who, like, you have both sides, and most people have very good reasons for either wanting to dive back in or wanting to take a slow and gradual approach. And so, you know, as a dojo, I would hope that, you know, you really look at the circumstances of your members, the circumstances of your region, look at and see what, similar martial arts are doing in terms of jujitsu or judo. Like when we were building our restart guidelines last year, we relied very heavily on the ones that were prepared by Judo PC. But I think you also have to be a little bit cautious about your interpretation of your public health orders, because Aikido is very difficult to categorize, right? We're not a sport. We're not a fitness class. Apparently we can be non-contact, which is somewhat surprising. I wouldn't have expected that 16 months ago. We can be high intensity, we can be low intensity, and all of these different factors influence what you are allowed to do, right? So there can be a tendency to sort of like what I call look for the loopholes, so that you can justify doing what you want to do. But something that Dr. Wolper again said very early on, the first time he met with people in BC, and kind of, he did a very good job of sort of explaining the situation, explaining what was unknown. One thing that he said was that, and that really struck me, and I know that it also really affected Barb Wolf, who's the president of the BCAF as well. He said that there is a large gap between what public health orders allow you to do, because they need to take into considerations like the economy, right? And what he would recommend for someone you loved, for a loved one. That there's a big difference in like interpreting those guidelines and those measures of what we're allowed to do. And I don't know, maybe it's because Barb and I are both mothers, but that really hit us hard, because regardless of where I've practiced, whether it was back in the old days in Vancouver or in Tokyo or here in Clearwater, I've always felt that my dojo was like an extended family for me. So I think you need to be cautious. You need to take in the consideration, like you need to consider your members and sort of adapt to what they're comfortable with. In terms of hybrid models, yeah, I'm all for that, because I think Zoom has a lot of really great potential. It can it totally overcomes physical barriers, geographical barriers. It can bring down economic barriers. It can improve equity and access to instruction. It makes it so easy to collaborate. And so, something that Kira said yesterday about, like it can be overwhelming when you're trying to go back and you're trying to meet all of these different needs of your students, right? And you're just one person in some cases, but if you collaborate with others, you can share that responsibility. You can get like some really good ideas just from talking with other people who are in similar situations or who have similar goals, but they're in different places, right? And so they bring different perspectives, and that sort of Zoom allows kind of like a really diverse collaborations. And I think that ultimately that makes us a lot stronger if we are able to pursue that.
Absolutely. I really like that you emphasize the increased access with the virtual classes. I think that this is definitely going to be a big factor going forward post-pandemic Aikido training, is the presence, the option of the virtual training, and perhaps some other type of training. Maybe some other things will spin out of this. So very exciting to see where this takes us and how it could enhance the dojo community in general. Mm-hmm. And I do want to eventually get into the discussion about, needing that, it's going to be tough. It's going to be a little bit challenging for the dojo chose, the heads of dojos, to adapt and adjust to this. There's going to be a little bit more of, a draw on their resources and their time. And I think that that's a really important thing that we need to discuss here. We need to acknowledge that. So we'll do that in just a moment. But just before we do that, I'd like to give Jean-François an opportunity to speak a little bit about how the training sort of unfolded. How did people get back to the training there in the US, and particularly the dojo where he is studying now and teaching? And so what are some of the things you're seeing in terms of the tolerance levels, in terms of maybe questions around vaccinations? Are people, is there a debate going on about, should people have to prove that they've been vaccinated? What are the types of things that you're seeing and hearing there in the United States?
In the United States, we have the discussion at the dojo when it's a sensitive topic because it's personal information. And but we have asked on a voluntary basis if people could disclose if they have been vaccinated. If they don't want to answer the question, it's fine, because we cannot force people to disclose that type of information. It's really sensitive. But to be honest, most of our members was really open-minded about this and disclose if they do. When we try, that all the vaccinated people now practice together, the one that has not been, they are in their class, and we try to accommodate people based on how tolerant they are about all these things. But and I assume in Canada will be the same. It's a sensitive thing because people believe sometimes are different, and it's and here there is a big debate about that, because it's even where I work, they will ask the question in a way that they don't ask you directly if you have been vaccinated, but it will imply that you need to be compliant to the rule that in place, and they will ask you, are you compliant for different things? And this will include to be vaccinated. And in other words, you have to disclose in some way, but it's not a direct question. And maybe we need to think about something like that, where we could ask a question that imply maybe to have to get that information, or then but again, here it's slightly different. The mentality is different, and people we're open minded. We try to really to Myrna point. We try to communicate with our student and understand their fear, their concern, and try to adapt the practice accordingly. With regards to either a video like we do today, a meeting or a Zoom meeting, people are eager to go back to the practice on the mat. That's there is no discussion about doing any virtual stuff right now. They're just looking to get back on the mat. That's what they're looking for. And but the interesting thing though, since a year we have practicing a lot with weapon, and the common theme is we would like to keep that a little bit more in our practice than we did before the pandemic. That's something that came with regards to the practice itself, and that's something that everybody was all agreed that we should do a little bit more of that in the future. And right now the class, we still have this mix because we get back, we have some contact right now, but let's say for let's say 1/3 of the practice and 2/3 it's weapon or kumijo, kumiken, and how it goes. But really here they don't talk about virtual training, or it's not in the discussion too much.
Very interesting. So at this point, there's not a lot of debate, not a lot of discussion going on about the virtual practice. Everyone is keen on getting back to the tactile, getting back to the in-person training. And well, it's not to say that it may not evolve to to a discussion where the virtual training opens up, but it's definitely something, a tool in the toolbox that we can use in the Aikido community. It is good to hear that in the example of the United States, everyone is keen just to get back to practice, to get back to some sense of normal Aikido training. Of course, it's, that may not be as much a factor. Really, the factor that we're here to consider today is how to safely do that. And that's the thing that we really are trying to draw out some ideas here in this forum and have that discussion. But thank you for sharing that perspective. Was there something else you wanted to say?
If I could talk about the Dojo, because I'm still in contact with my people over there. And as you know, we have reopened 2 months in August and September last year, because we have put a protocol in place and all of that. And we closed down in October, and we reopened for 2 weeks in March and closed down again because we were following the Quebec regulation. But it's the same. To be honest, I talked with a lot of my people, and they all would like to go back on the mat again. And some of them told me they prefer to wait that the situation get better than having compromise or video or stuff like that. They prefer to wait until we could really go on the mat like we were before, even with no contact. At least we are 6 people on the dojo doing a training together with social distancing, but there is this human part of it that it's maybe more tangible than what we do now, which I think it's great. I'm pro for. I'm using my work to use Team and Zoom meeting all the time. But some people are less familiar with those technology, and it's a mix of.
So that's interesting. So you've had to pivot a couple of times. You opened the dojo, then closed it, then opened it, then closed it again. So just real quick, and I know Myrna, you have a point that you'd like to add, so we'll get back to you in just 1 second. But just real quick, Jean-Francois, what was it like? What was it like, ramping up, opening up the dojo, then closing it, and then and then choosing to open it again and close it again? What did it feel like? Was it very involved? Was it, tell us a little bit about that experience.
The first time when we reopened in last August, it's sure, I was fortunate because one of my students was in that business, and he wrote the plan for us, follow all the governance requirement. We put a plan in place for sanitation and all of that. And that's where you need a little bit more hands-on to prepare the dojo for a re-entry, because you need to have your cleaning protocol in place. You have all the signage that need to be in place in your dojo about how to wash your hand and all of that stuff. But once this has been done, and after that, the protocol, the way we wrote it, the guy put the different phases of reopening, and the most restricted to the less restricted. Then after that, with just good communication with the student, we say, hey, we reopened the dojo that day. This is the protocol to follow. That's what you have to do when you enter and when you leave the dojo. And we are on phase 4 as an example. And that's a good example because in August, we were in phase 4. After that, the government reduced the restriction in September. Then we move and we send an email to all the students and say, hey, now we're moving to phase 3. Which were permitted the bubbles. We were able to be the same people practicing with contact for during a practice. And in October, then it changed, and we have to close out. Then once your protocol is in place and it's well, we send a copy to each student. And we just follow the protocol as it is. We say, hey, we're in phase 4, phase 3, phase 2. After that, we go back, we close the dojo. When we reopen in March, we say, hey, we reopen in phase 4. And people and also you need to have a scheduler because you limit your people in your space. And we try also, we ask people, select a day you would like to come to the dojo. And you try to keep the same people practicing week after week together and not mixing people, because for the contamination, someone get positive. Now you need to in your protocol, you have this section that say, okay, you need to call back all the people who was exposed for more than 15 minutes and stuff like that. And I think the key is to have a clear protocol in place. After that, once it's done, then it's easy to move on with it. And you can
okay. Yeah, you do need to be nimble. So that's something that we do need to keep in mind going forward. And I suspect that that's something that will come out. I do have two more questions to ask, and I think we'll be able to dig into that nimbleness, that tolerance, that flexibility aspect from everybody in the Aikido community, and being able to adapt quickly is something that's going to be important. But Myrna, there is something that you did want to add a moment ago.
Oh yeah, I just wanted to say that, you know, of course, there's no substitute to in-person practice. I mean, here, you know, this virtual seminar is like sort of taking the place of our usual summer camp. And after the first day, I'm not sore, I'm not tired, my gi isn't stinky, you know, but I do still have that sort of like excitement in my mind where it's like, I got that shot of beginner's mind, you know, where you realize, wow, there's still so much to learn, you know, and that is like really rejuvenating. And, you know, the class that Osawa Sensei taught last night was so fantastic, not just, you know, because I was a bit natsukashi, it was like, oh, Osawa Sensei, home dojo, you know, but also like, I don't know if you noticed we had two different dojos from Russia join us. And apparently they were like, it was the dojo that was joining. You know, they weren't wearing masks. They were practicing as a group inside. And I just thought that is exciting because it means that, you know, Osawa Sensei was teaching in Japan. There were people from around the world participating. Some had to practice solo, but others were, you know, practicing with their partners. So they were having that tactile in-person experience. But, you know, because of this sort of hybrid model, we have like greater access to worldwide instruction. And I think that's really exciting and something that I really hope that as a group, the CAF pushes to like continue and carry forward. And we can get our booster shots of Osawa Sensei throughout the year. That would be great, right?
Absolutely, and that's interesting. It's kind of like, you know, it's a vaccination for mental health, right? It's
Absolutely.
It keeps us going, and so this goes back to that mental health aspect that Ben and some others in the chat forum have raised. And you know, this is an important factor, even though we may not be getting the tactile practice and training that we crave. There are definitely some inherent benefits that we can garner from other forms of practice, and we need to be open-minded for that. So there was an interesting question, Michelle, that I would like to maybe ask for your help. Some folks are asking in the chat screen, what are the risks with outdoor practice? Are they sort of, you know, how is it different outdoor practice versus indoor practice with the aerosol transmission? And also, while you're responding to that, the theme of the next part of the discussion is kind of the different forms of training. Right now, the chat session, the chat room is exploding with questions and suggestions about how to have different forms of practice. One was just mentioned that maybe you can have the tactile in-person practice, but then also stream that so that way folks who want to stay at home and practice virtually could do that safely. So that way it's less of a burden on the instructor and the dojo to facilitate two different sessions. You're still having the one tactile person-to-person training that is streamed so folks can participate in that class, but virtually. So first question to you is the difference in terms of risk with outdoor training, and are there clever ways, good ways that we can prepare and present as the dojos, as the instructor, different hybrid versions of class?
Okay. The aerosol transmission when you're outside is really low, much lower. Okay. So that's why now, like in the Quebec province, we start to be able to do sports outside with groups, like playing soccer, playing other sports that get into contact. Okay, so there is much less transmission when you are outside. Okay, another thing that I can say that, I mean, life will never go back exactly the same way that we were before. This is not a negative point. It could enhance our practice. Like doing so, like Myrna said, Zoom classes are going to be here to stay. You know, I mean, going to outside seminars is very costly, and you know, you have to go away. And even for us as teachers, it's fundamental that we keep ourselves up to date in our Aikido practice. So I think Zoom practice will be here to stay. The second thing is, I don't ever think that no one will not wash their hands before they go back to practice. Okay? I think this is going to stay. I don't know if you have noticed that in your provinces. This year, we didn't have any flu outbreaks. We didn't have any gastroenteritis outbreaks. Why? Children were always washing their hands carefully. They would be, the washing of the hands is the main stake of what we have to put in place. Okay, so I really don't think that we'll just go into the class right now without washing our hands with an alcoholic solution or hands and soap. Disinfecting the material, like if I use a boken, everyone should have their own weapons. I think so. But when you are beginners, you don't have the money to afford this, and you don't know if you're going to continue practicing Aikido. Okay, so if I share my boken with someone else, I would disinfect, okay? Because not talking necessarily about the coronavirus, but some other viruses can be transmitted with organic liquids, such as the sweat. So I think it's important to now disinfect. I will never, ever go back to doing my grocery without disinfecting the, how do you call that? The chariot?
The shopping cart.
Okay, thank you. And disinfecting my hands before and after, okay? I don't think we're going to go back eventually to mask all the time. But one thing I would emphasize with my students, if you have a cold, please wear a mask. You can practice with a cold because we have to be not paranoid now, okay? Yes, we have a coronavirus now, but you know, I mean, we always encountered colds and some other minor respiratory viruses, gastroenteritis. But I mean, it's life. It's, if you don't want to catch any virus, keep a 2-meter distance and don't encounter any contact with no one. But we have to go back to a former life, but with changes. Did that answer your long question?
Yes, you did. You did. And also in terms of the, you know, we're getting a lot, like I say, of folks inquiring about, you know, the different blends of training. And so this is a question to you, Myrna, and this is again regarding the role that the dojo will play, and specifically now let's focus on the instructor, because this is going to be a little bit more for the instructors, for the dojo cho in terms of managing everything. So how can we, what do we do? Do we support each other? Maybe there's a forum that could be created where all the instructors are sharing ideas, sharing experiences along the way. Aiki Blaze seems to be taking off very well, and it's an opportunity where people can share experiences. But you know, as a community, let's be honest, we need to support those who are taking the lead and making Aikido practice available to the community. And that's largely the folks who are, you know, taking the time to, you know, establish a dojo, maintain that dojo. So what are your thoughts around that? Is this something that realistically the dojo chos can do on their own, or can we get support from others in the community?
Again, it depends on individual circumstances, but it's a lot to take on if you start having to, you know, like having to think of, I have a small dojo and having to think of everybody's different needs. That's a lot, right? So the more we can collaborate, the easier that burden becomes on the instructors, I think, you know, because, you know, like if you have some people who want to get back to in-person practice, have a class for that. if you have people who are hesitant to do that, have a Zoom class for that. And, you know, like I'm trying to keep an eye on the chat here, which is just like, there's so much into it, but I'm not good at multitasking. So I'm just gonna say, there is an obvious interest in talking about these things and trying to see what other people are doing and helping each other. So should we continue these discussions like the one we had yesterday and the one that we're having today? Absolutely, let's do it, because I think it's gonna help all of us, you know, and again, let's do it in a forum where people can ask questions and interact directly. So Aiki Blaze we were going to stop for this summer because, you know, life gets busy and there's a lot of other stuff going on that needs to be done as well. But, you know, if people want to get together to talk about things, I'm happy to set it up. Just let me know and we can do it.
Excellent, excellent. That's great input, and thank you for sending that offer out. And Jean-Francois, what about you? How's it been getting assistance? Have you been getting any support from students, from others in the community in terms of keeping the dojo going and making sure that the dojo is as diligent as it can be in terms of making it a safe environment for practice and also complying with the guidelines, the latest and greatest directions from the local or regional governments?
Yeah, I had a very good collaboration with some of my members, the instructor, because as you know, I'm not there, then it's all my student that I have 3 instructors, and like I mentioned, I have one of my students. I'm fortunate because he's in that business. He's writing protocol for company to reentry for their employees. Then he was supporting me doing that. And to be honest, and maybe that's something we need to talk commonly all together, because I'm sure some dojo will need help, because if I would have been by myself to write this document, I didn't have the competency to do that. And it's a legal document, because technically, if you are audited by, you need to show that what is your guideline and your protocol to win. And yes, I do have support. My student is there, and we like I mentioned, I think. And Miriam, you touched it, because we need to stay very close contact with our people to understand how they feel about that and try to adapt. And we are about 4 people really involved in the administration of the dojo, and it worked well. It worked very well. But I think where maybe some dojo will struggle, like I say, I was fortunate to have the student that have this background to help me. But for those dojo that doesn't have anybody like this to help them to put the protocol in place, it could be a challenge.
Absolutely. And so, yeah, as a community, I think we need to really acknowledge, you know, where those dojos are that could perhaps benefit from joining, you know, the smaller dojos with the less resources. You know, we'd like to be able to ensure that there's a forum for them to reach out and to get that support. You know, that's something that will evolve. I know that the CAF board is looking at ways in terms of supporting the community at large, even if it is to, you know, point you in the right direction to say, here's where you can go and get some information on the latest and greatest. You know, guidelines, recommendations, protocols, and specific to your area. And that's key to us at the board, is that we'd like to be able to catch as many people as possible in this initiative. So there will be in future some guidance from the CAF to say, here is where you can go read up on some information, and it will be specific to your region, because obviously There's other communities, there are other individuals, institutions that are going through the same thing that our Aikido community is going through. The States, the folks in America are a little bit ahead in that game. And so we could perhaps not have to reinvent the wheel, but learn from some of those opportunities there. And Jean-Francois's input is vital in that way. And we thank you for that today. So definitely reaching out right now, sending a message to all the instructors in our Canadian Aikido Federation and abroad is, let's work together. Let's share information. Let's build maybe those forums now. Maybe that's what we do, is we focus on building forums for people to share ideas, share information, and best practices. So that way we can get back to safe practices. And Jean-Francois, I think you had something you were going to say.
You touch it, because I see these help should be at the province level, because I think the regulation is slightly different from one provinces to another one. Like I could share my protocol with other Quebec dojo because we are under the same regulation, but maybe in Ontario it could be slightly different. In the West also could be different from Alberta, BC, and other provinces. And I don't have this detail, but I think, but the framework should be very similar to one another, because in my protocol, we also had all the link that tied up to the government regulation. Then if people are curious, they just click the link, they could go and educate themselves. But I think it would be true for each provinces. They probably have their own link to get the information. But
yeah, absolutely. So unique guidelines, unique scenarios, unique environments will require specific steps to reopening and to maintaining safe practice. And that's something that, largely the dojo chos will need to access. They'll need to find that specific guideline that they need to comply with. But on a larger scale, just in general, sharing that information, sharing that experience is going to be vital going forward. And I think that's something that we can definitely support everyone together. Michelle, was there something you wanted to mention? We do have 7 minutes, and I know while we're having this part of the discussion, if there's any questions that we did not get to that you would definitely like to maybe try to get answered, you can put that in the chat, and we'll try to get to those. But we're nearing the end of our discussion, so we'll close it off with Michelle. Any last points, questions that you'd like to add?
Yes, I see there are a lot of questions about insurances. Okay, the executive has been working on different documents that were sent to us about waivers, about COVID-19 declaration. So we all work on these documents and to make some changes and adapt to the situation that we live in. There probably will be some changes like about the responsibility, the declaration, because there probably will be one point with vaccination. But this is something that we've been working on. And so as stating in the, let's say, the COVID-19 declaration, because I've been working on it with Don Ragush and also with Steve Erickson. So we don't live the same situation from west to east. So we cannot function only on one way of functioning. Like Jean-François was telling us, there are different levels of not responsibilities, but things to put in place according to a situation on what we call a green level place, or because we have a system of colors. So the Quebec is lowering down. Now we're getting orange, yellow, and some places are green. I'm not going to apply the same requirements on green than red. So having different ways of opening according to the situation will be good. So we still have to work on this, but we've been working hard as the executive on these points recently, since months, in fact. Merci.
Yes, and it's continuing to evolve. Myrna and yourself, we're closing off the discussion. Was there anything that you would like to emphasize, anything that we may not have touched on that you would like to share with the audience today?
I would just like to really emphasize, I think that, You know, in Scott McMillan's report that he prepared for the CAF, he talked about, you know, like a unique selling point. I think that one of the things that really differentiates Aikido from other martial arts, and that is in fact a very strong point, is that we do community really well, because our training is a collaborative effort. It's not a competitive effort. So we're used to working together to make each other better. And I think that that is our strong point. And I think that we got this, you know, it'll be okay.
I agree with you on that point. We've come together to do amazing things, and this virtual seminar is just one example of that, pooling all the resources to come together, keep that mental health going, keep everybody stimulated, get that Osawa vaccination, and you know, keep everybody engaged. So this is definitely true of the Aikido community. And Jean-Francois, any last points that you would like to make? Anything in general that you would like to say that may have been missed, or?
No, maybe in general, I think the future is to keep this good communication all together. I think that will be the key component of the success of the future of Aikido is as an organization. If we change ID and share experience we have, that will be the best way to move forward. That's my thought there.
Excellent. Thanks everyone for their input. Sorry.
Maybe I could add, I was listening, a lot of people looking at comments. Maybe the future could be, there will be some, and it's always about money, but some investment in technology, because I was thinking from some dojos who have a bigger screen where we could a sensei from Alberta or BC teaching a class for a dojo in Quebec, but you could be with your student in your own dojo and maybe we could spread it out and across the country. But if we could be in our space with some technology in place to practice, like the Russian, I think they were in their dojo yesterday. Then it could be a way to go that will maybe make this video or Zoom session training more interesting for people instead of being by yourself in your basement or in your room. Just a thought like that.
Absolutely. I fully expect that things are going to evolve. Nothing stays the same. Everything changes, and we can expect that in the Aikido community. And it's like Myrna was mentioning, it's hopeful change that we could look at, because we're all such thoughtful people in the Aikido community. You know, we're a positive set of people looking for best practice, looking for best ways to go about doing things and harmonizing with our situation around us and harmonizing amongst each other. So thank you all so very much. There was a lot of great input, great conversation in the chat room. So thanks to our audience for putting in a lot of great information. I know that there is some great appeal for continuing the discussion going forward. And our next session is, well, right now it's going to be the virtual class. So Hillary, it's going to be the Lunch and Learn, the historical lecture with George Houston Sensei. So that will start at 12. So let's close off this discussion. Thank you all for joining, and keep an eye out for future direction and future forums, perhaps, to continue this discussion. Thank you so much, and thank you all for joining. Thanks to our panelists.
Thank you.